right, everyone. I'm here with one of my very good friends. We've decided that we're not going to say her name, so what do you want us to call you? Francis was calling you Peggy, but we can call you whatever you want.
Let's do Peggy. Yeah, I like Peggy.
All right, this is Peggy the nurse, and she works... That sounds sexual for some reason. I'm thinking of Peggy. Sorry.
How does Peggy get sexual? I'm wondering.
Pegging? You don't know about pegging?
Oh, I was thinking like Peggy from, Married with Children. I didn't know.
Well, that's nice.
But pegging? What? This is, okay, I'll look it up after.
No, we're going to go.
Let's do it. What the hell's what's pegging?
Pegging is when, if you have I guess doesn't have to be, but it tends to be when you have a heterosexual couple, and the woman wears a strap-on to perform anal sex on her male partner. I'm
going to look up if peg is
Latin
Latin
women can
for
peg
something.
Women, and I'm sure men could peg men if they wanted to, but I think that's usually how people use it.
Oh, well, I didn't peg it for that.
Anyway, so that's why I was thinking of sexual. Sorry. Anyway, audience, this is Peggy, the nurse.
Oh, God.
And the reason we're interviewing her today is because she is an amazing nurse at a local hospital, which we'll keep unnamed, and she's working in a COVID unit. So, yeah, I mean, we're probably not going to say anything that would get Peggy in trouble, but, HR departments, and I remember I got nervous because I saw all those stories that came out back in, early March about doctors getting fired in the city for talking about running out of PPE. Did you hear about that?
Yes, I did.
Yeah. So, I mean, just in case, we're just going to keep it all anonymous.
Sounds good.
So, how you doing? What have you been up to?
I'm doing well. I've been working, obviously, and then self-quarantining, which is really not out of my norm. I've always kind of been a homebody, so this is no different than what I'm used to, except grocery shopping, because that's an adventure.
That is. Our guest. I think you said you listened to the last episode. Our guest was talking about how most of his the people he's doing deliveries for, because he works right across from the hospital in Kingston, are nurses because they don't want to go to a place in their scrubs and get in trouble or get people harassing them. Have you had any bullshit like that?
Oh, I'm telling, because I went to go grocery shopping before work, and I was in my scrubs, and I got the dirtiest looks, and everyone was just trying to stay more than 6 feet away from me. And it honestly, a lot of the times, it's a little disheartening because, you see all these signs, thank you, healthcare workers, you're appreciated, we love you, and then when people see us, I mean, it's not the warm welcome you would expect, and it's a little frustrating.
Yeah, I can imagine. And also, it's not like people, I don't know, I had a bit of an online fight with somebody I was complaining about my job, which obviously isn't even close to as dangerous, I guess, or exposing you to harm as your job, but I was just saying how, it's people are being rude about other people being around and going out and about, and some of us have to work, and he was like, no, that's bullshit, nobody ever... everyone treats you guys like heroes. Nobody's being rude to people who are out doing deliveries right now. Nobody's being rude to essential workers. And I was just like, is that a fact? Are you sure about that?
I'm going to say from my experience, I don't know everyone else, but I have not experienced that. I get a lot of people just looking at us differently, and I've heard a lot of other nurses and PAs and MPs and doctors say the same thing. It's just really an oxymoron, honestly. You hear, thank you so much, but we don't want to come near you and you're disgusting.
Right. Yeah.
But, I mean, we honestly, yes, we are exposed to people directly, but the hospitals have eliminated visitation, so we're not exposed to the general public as much.
Right.
And people are going grocery shopping, not wearing the proper PPE, sorry. But that's... why I think, if anything, we're more protected than the general public at this point.
I heard some numbers about that, actually. I should have looked at the study before this. And I'm sure it's just initial stuff. Nothing, there are no long-term studies on anything yet. But some numbers that came out recently showing that essential workers are actually getting infected at a lower rate than the general population in most parts of the country right now, because I guess you guys are just using proper protection and are more used to knowing good hand washing protocols and good hygiene protocols, and it's more second nature to you guys, whereas the rest of us are all like trying to remember not to scratch our nose when we're wearing gloves, you know?
Yeah. Well, it's all preliminary, but from what I see, I agree with that because, I mean, I can't speak for the city, but I work in the Hudson Valley, and obviously we're different than the city and other major cities of that kind, but we are getting protective gear, and we have spotters if we're going into the patients who are on vents, intubated.
What's a spotter?
So when we go in, so what they'll do is, it's usually a tech, they'll get us garbed, so we'll don on our gear, and they'll tell us the
When you
proper
say get them
order.
garbed, you're saying you're standing there and they like come and like put the stuff on you for you?
Yes, they'll tape us up, they'll help us, they'll like put gloves on first, put on the gown, put on an additional set of gloves, put on your N95, your surgical mask, your bonnet, your face shield, and your booties. And then when we're in there, in this gear, for sometimes 8 hours straight, we come out and honestly, we're what's called hypercapnic. I mean, we're breathing in our own CO2 for hours and hours, so you're just so tired. So when we come out, they're telling us, take off your gloves, sanitize, take off your gown, sanitize. You know, they help you walk through because honestly, you're not thinking well regarding your PPE. When you're in there with the patients, it's different. But once you get out of that high intensity adrenaline mode of, I got to take care of these patients and make sure they're getting what they need, you don't think about yourself when you're coming out. You're just like, I just need to get this stuff off. So you need someone telling you, this is how you do it. And that's what I really appreciated about what my hospital's instituted. That's been a huge, I think, help with us, putting on our gear properly and taking it off properly and preventing infection spread.
Right. And actually, that brings me to one of the questions that somebody sent me. I'm trying to find it right now.
Yeah, I'm pretty stoked that people are writing about this.
Yeah,
it's
me
cool.
too. I thought that was really sweet. So Jesse Smith, he's actually a local journalist. One of his questions was, what's the PPE situation?
At my hospital, it's actually pretty good. I'll give some backstory, so I will go on a little bit of a tangent and come back.
He did ask, like, not just right now, but, like, has there been an issue back before or whatever?
So when this was all happening, obviously, we've never dealt with anything like this. COVID has always been around, but COVID-19 is a whole different beast.
Right.
So,
like the 7th one or the 8th one, something like that?
Yeah, I don't know, but that sounds about right, because I know this is not the first go of this. But
and I know, I looked it up once. I can't remember the exact number once, but I think there's like, someone I'm sure will check me in the comments. There's like there've been like 8 of them. And I think most of them were common colds. And then there was a couple that were weird, but nothing like this one.
Yeah, and these kind of viruses, they mutate, and that's what makes them dangerous.
Right.
And COVID's so scary because, in my opinion, it kind of acts as a cancer. I mean, it literally has these, you've seen pictures, they make them look like mean, angry circles with spikes coming out of them when they show those COVID pictures. But that's what they cling to your cells, and they mutate them in a way. And that's how fast it'll spread throughout your body, and people decompensate so quickly. I've never seen anything like it. They go downhill. I mean, they'll go from saying, oh, I don't feel great. Yeah, please, sometimes I'm really not good at not using medical terms.
I'm not going to lie, I knew what decompensate meant, but I just wanted to ask you so that you would explain what it meant.
Yes.
It's a little interview technique, It's like, all right, that's a medical term. I'll ask you what that means.
Oh, no, that's totally cool. Please stop me if you have to.
Yeah.
And so I've just never seen something progress so rapidly, especially for the younger population. That's what bothers me. Well, we'll go back to that. But so when this all started, we weren't prepared. We didn't know. We never dealt with anything like this. And being, in a less populated area, we're not in New York City. Mm-hmm. I know New York City had a hard time, but I felt like they were more the focus than up here.
Right.
So, our hospital realized that our ICU units were really getting overrun, and they didn't have enough ICU
When was
nurses to
that
handle
happen?
this.
About when was that?
I'd say beginning of March we started.
So already in the beginning of March, you guys were having your ICUs overrun. Because I feel like
Yeah.
See, this is what makes people feel. I see this all the time on Facebook. People who don't personally know anyone who's gotten sick yet, or they know somebody, but it's a friend of a friend, or somebody from middle school's mom. It's not personal yet. And even then, still, I guess even when it is personal, because you still only know like that one person that you know, they don't realize, they're like, oh, well, it's not that big. It's not like, so there's all these other things that also make you sick, blah, blah, blah. Dude, ICUs have never been overrun because of people having the during flu season. This is not a flu season level issue.
The ICU.
Like,
yeah. I mean, and that infuriates me when people say, oh, well, it's just a bad flu. No, it's not a bad flu. We can handle the flu. If a patient needs to go to the ICU with complications from the flu, such as pneumonia and
right, but if those never happen in numbers, that would overrun an ICU.
Never. No.
Right.
That's what makes it so different. So it wasn't like we were super overrun.
Other people can get really sick of other things, and it's not the end of the world. It's like, yeah, but it's not happening in the numbers that this is happening. Anyway, I'm sorry, I keep interrupting. Yeah, so you guys are having problems in the ICU.
Yeah, but going like what you were just saying, I mean, it's like AIDS. You don't die from AIDS. You die from complications that the autoimmunity caused for you. So you get infections. You get, tuberculosis, depending on what you're doing. It's just not the same as anything we've seen before. I'm sorry if that made no sense, but what I mean to say is you don't die from the actual COVID. You die from
that makes perfect sense.
Associated.
Yeah.
So in the beginning, the ICUs in the beginning of March we weren't overrun, but we saw the capacity for it. And then in mid-March, we noticed that we were getting a high volume, and the ICU nurse manager instituted an education program for non-ICU nurses to take. It would be an 8-hour ICU class so that you could be assistant to the ICU nurses, because ICU nurses usually have a ratio of 1 to 2 patients, depending on how sick a patient is.
Okay.
These nurses were getting 3 patients.
Okay. And this is back in March?
Yes.
Okay.
And that's because these patients are on paralytics, which paralyze your body so you can't feel anything. Sedatives, where you can't feel anything, but so you can maintain the patients on vent without them resisting and having a hard time having a tube down their airway. So It's just a lot
I didn't think of that. Of course you'd have to be paralyzed or, sedated for that.
So they're on 5 different major drips. So you got propofol, ketamine on some of these patients, Versed.
Damn.
And these sometimes, and especially with these COVID patients, these are at high levels. So these medication bags run out in an hour, and if you've got 3 patients on 5 to 6 drips, you got to make sure you're changing the bag. So they wanted to train med-surg nurses and cardiac nurses and to step in as helpers so that they can help change the drips when they were running low, suction patients, be an assistant basically. So with all the things that have to be taken care of for these patients, they needed help. So they set up a class for nurses to voluntarily sign up for. I took the class, and they gave us an 8-hour ICU education on what we could expect from these COVID patients, and then we were floated to the ICU intubated units, which as this progressed became more units. We started shutting units down that were meant for, post-op surgical patients, and now that isn't happening because we're not having procedures. So those units became our ICU intubated COVID patients on vents. And then, we would float to those units and help out as best we could. But that's when you're in full PPE the whole time.
See, I think what is really interesting about what you were just explaining and the way it applies to us who aren't in the medical field is that um, people aren't realizing that the damage to society caused by the number of COVID cases spiking is not just going to be based on how people are harmed by COVID-19. It's also going to be based on how people who would have gotten that surgery who now can't get that surgery because you guys need to use the post-op room as a COVID unit. You know what I mean? Like, it's not just affecting the people who get COVID, it's affecting the whole medical system, the whole way the hospital is run. Like, which nurses are available, who's gotten enough sleep. Like, it's not just the COVID patients who are the ones who are going to get harmed by there being a spike in cases. It harms anyone who could get sick of anything.
Right, and that's why they stopped doing any elective procedures.
Right,
so there were required, someone's dying of appendicitis and we don't want them to become septic. Obviously, we would have a clean area for them to go to get the surgery and to go to a post-op area where they could be monitored closely after anesthesia. But certain units where we felt like we could actually use during this time, since we weren't being overrun by, hey, I want to get, I don't know, toe bone shaved off. I have no idea. Just making something up. But, just anything that wasn't life-threatening was on hold. And the main thing with this is that's why we're doing this, the isolation and self-quarantine, is because if we have people coming into the hospital that aren't critical, that don't need care right away, I mean, we would be overrun. We wouldn't be able to handle all these COVID patients plus these patients who have toe pain, which I've seen people come in for toe pain. But I've seen, I'm not going to tell you, I mean, people come in with the dumbest things sometimes.
Well,
like, are you
my dad's an ER doctor, so he's been telling me people come into the ER for crazy things, like, for a long time.
Yeah. And the thing is, there's pros and cons to that. The con is a lot of people who really need to come to the hospital that are critical are not coming in. I can't tell you how many EMTs have told me that they responded to a call of someone dead on their kitchen floor because they had a massive heart attack and they were afraid to come to the hospital. It happens.
Oh my God, that's crazy. And you're talking at your local places and something you saw on the news, like that happened here somewhere.
Oh yeah, I didn't read it on the news. But, someone who's on the front lines of it.
Right.
Like, a lot of the stuff I'm telling you, I'm not gonna lie, since I'm exposed to it at work all the time with COVID, I try not to watch TV too much. It's just, I deal with it enough. Sometimes you just need to separate.
Absolutely.
So everything I'm telling everyone, just heads up, is from personal, direct experience.
Right.
And that's
and
then everything's preliminary right now.
Right. Some of these questions that people sent in to ask you, I just want you to know, just answer whatever you feel comfortable answering. Okay. If any of these are seem weird to you or are just something you're not comfortable with, whatever, then we'll just skip it. But do you want me to read you some of these questions?
Yeah, can you go back to Jesse's question? Because I don't think I even answered it.
Oh, yeah.
So, Jesse, I'm so sorry, but there's I'm in self-quarantine right now. I have no one to talk to, so this is a really good outlet for me. So sorry, Jesse. Let's go back to you, my friend.
I'm the queen of side conversations that get out of control, so you don't feel bad. All right, so back to Jesse's question. I would like to ask her to take us through the course of the epidemic from day one to present. What are lessons learned? Were there ever shortages of PPE? Did coworkers get sick or decline to continue working? And if so, how did you guys deal with staff shortages?
All right. That's Jesse's question, the first one?
Yeah, Jesse was the one who brought up PPE. So, I mean, you already kind of started. You were telling us how, all right, the ICU started filling up, so you guys started moving nurses from where you used to work, the cardiac unit, and other places into the ICU.
Yeah, so we were actually really good on PPE considering. I feel honestly thankful for that. I have not felt uncomfortable going into a COVID unit presently, and I'm thankful for that, honestly. But I know that's not the case everywhere, but I'm just speaking for what I've experienced. So when this all started, they were really being careful because honestly, people were stealing masks. I'm not saying hospital workers, but This time, we actually were allowing visitors because it was still evolving, and visitors were literally stealing surgical masks because we have when you walk into a room, one of the patient's room, on your right, there's a bin that has gloves, masks, and gowns in every room, even if the patient's not on isolation. So, because we deal with isolation other than COVID, I'll tell you that.
Yeah.
So we were noticing we were running out of surgical masks, and we figured out that we saw people putting surgical masks in their pocketbooks before they left from visiting their loved ones.
Wow.
Yeah. So yeah, after people started noticing that visitors were stealing PPE, like surgical masks, our managers wanted to preserve our supplies and started locking them in their offices and giving them to us when we asked. And also, N95 masks, we barely use those. Those are used for what's called airborne precautions, which is when aerosols, like your cough and your spit and all your breathing goes into the air. It can travel through the air. And
that's the droplet thing everyone likes to talk about, right? People are always talking about droplet size.
Well, droplet is flu. So if someone coughs on you, that's when you got to worry. So for flu patients, we just wear a surgical mask. But for N95, that's for tuberculosis patients, TB. And we don't see a lot of TB patients. I've been a nurse for 6 years. I've probably had 3 tuberculosis patients. So they're just not a supply that we're used to needing to carry a lot because we don't get those kind of patient populations a lot.
Right.
So that's what the worry was when I first heard about this, that we're going to need airborne precautions. I knew we did not have a lot of N95 masks because they just have never been really that required. But my hospital actually had a stockpile, which was really nice to know. Yeah, I was really impressed by that. Actually, just to go, so we get our annual testing every year for our TB masks, the N95s, and, just blood pressure, all that stuff.
Yeah, I used to have to get that too, the mask. I used to have a really nice N95 mask back when I worked in the doctor's office, but they took it back when I left.
Ew, wait, what? They took it back?
Well, I know they're supposed to throw it away. I guess I probably didn't even need to give it back to them now that I think of it. But when you leave a job, you give them back everything, your cell phone, all the stuff that they bought for you. And I just assumed that the mask should go with it. But I guess now that you mention it, I probably should have just snagged that shit. It was really nice.
You should have just kept it. It's not like a gun and a badge for a cop. I breathe in this. Here you go.
I forgot that those are one person only. Shit. What's wrong with me? Anyway, sorry.
And they're one use. So technically, when you go in a room that's airborne precautions, like tuberculosis and COVID, and you put on the mask, you're not supposed to be in that room for more than 30 minutes. You want to lessen your exposure. So when you leave that room, you throw it away, and outside the room there's a box of N95 masks in your size, and you reapply a new one when you go into the room, which obviously is a problem with COVID, which is why now healthcare workers, I'm going to say mostly nurses, because in those units it's nurses. There's no techs in there cleaning the garbage from all the IV tubings and other garbage that we have. There's no environmental services coming in. Like, the nurses are in there cleaning, taking care of patients, calling pharmacy, getting supplies, scrambling at times, but doing it well. I've been really impressed with how our nurses have been doing it. And I've seen one doctor come into a COVID unit. He was there for, not disrespecting them, I know they're doing great work, but they were there for 10 minutes, and that. And other times they just Zoom in conference with us. So we walk around with an iPad telling the condition of the patient, changing vent settings, and what's going on. So
I guess I never really even thought of that. But yeah, if you're trying to reduce exposure to the staff of a hospital, you want to have the least number of people in the COVID unit as possible, which would mean that you guys are doing everything.
Right, and which makes sense because there are more nurses than doctors. PPE, it's been good. So there's different units right now. So I'll say at the beginning of this. So I work on a post-cardiac unit, so we deal with heart failure, stents, AFib, which is an irregular rhythm that can cause stroke, patients who have defibrillator or pacemakers inserted, things like stents, all that stuff. And so, sometimes we'll float. You'll go into your unit and they'll be like, on a normal day without COVID, they'll say, oh, the nephrology unit is short a nurse, so you're floating there tonight. So you go to the unit, which is not your specialty, but you're there to support and help. So, we're used to floating. So what they first started was the ICU obviously had their units, but there needed to be a step down, which is the next level of care after ICU. Because med surge is more like you got 6-7 patients, and sometimes they can be critical, but their acuity is lower, meaning they're not as unstable. Obviously, they can become that, but you just get more patients on med surge. Then step down, you have a lower patient ratio because they're right in the middle of, hey, are they going to need to go back to the ICU, or can we progress them to a med surge unit and they're stable enough? So it's kind of like a watch and see game. So cardiothoracic step-down unit, which deals with open heart patients, that turned into our step-down COVID unit. And then those nurses who usually work open hearts came to our unit, the cardiac unit. So we've been sharing a floor with open heart nurses, and it's been a transition, but it's worked out. So when I first floated down to, this is before the ICU classes were offered, I stepped down to the step-down COVID unit. My first time there, I was so nervous. I mean, I didn't know what to expect. You're just down there and they're like explaining everything, like, all right, so we have this code system. If this patient is on 6 liters, they're in the red zone, and you got to let anesthesiology know because they might need to intubate this patient. And you're just like, oh my God, okay, all right, don't kill anybody. Let's and you're like,
don't kill anyone.
That is always the goal. But did you die? That meme? So true.
Yes.
So true. So thankfully I was there with 2 other nurses from my unit that floated down there with me. And at that point, it wasn't a full-blown COVID unit, meaning we weren't in the PPE for the whole shift. So at first what they did was they had 2 nurses together caring for 4 patients, which is unheard of. That does not happen ever. So I was like, that's sweet. I feel better. Thank you. Okay. I'll take it. And then they had a line that you crossed. Once you crossed that line, you had to be in full PPE gear. So you had a nurse that was going to go be in full PPE gear, stay outside the patient's rooms, and then the other nurse was going to give you all the meds, call the doctors when you told them, hey, this person went from 98.6 temperature to 103 in literally a half hour. We got a problem. So it was a nice system. But, the most important thing is with airborne precautions, which is associated with COVID, the patient's doors need to stay closed. If you're opening that door, someone needs to stay 6 feet away from that door at least, because it's in the air. Droplet, you cough, it drops. Droplet. That makes sense. Airborne, just floating out there in the air. It's easy to breathe in. And so when I picked to be, I'm like, I just want to get it done. So I picked to be the nurse in PPE and have the other nurse pass me the meds and take care of everything. So we go in, I see these patients. I mean, it was insane. There was young people. I had 44-year-olds. I had 55-year-olds with barely any past medical conditions and like maybe hypertension and diabetes, which is a problem. But so that's how it first started. And then then it progressed where that CT step-down unit that became the step-down COVID was all PPE all the time. As soon as you entered that unit, you needed to be geared up. There was no line to cross and then dress up. As soon as you entered the doors, you got in gear. There was like an ET net where it's like a zipper. It was crazy. It's plastic like barrier with a zipper in the middle where you would open it and be like, I'm coming in. You open it up and you go in. It was crazy. But I'll tell you about the first time, the second time I floated down there, because I was mostly in the ICU after I took the class. As soon as I came on shift, the doctor's like, oh, we're intubating a patient, send them right to nuclear med. And, we had to figure out, the nurses, all right, well, how are we going to get this patient out? It's change of shift. He's been on an ambu bag, helping
What's
his
an ambu
breathing.
bag?
It's a way to push oxygen into a patient's airway without having direct contact with them from mouth to mouth.
All right, gotcha.
So that patient got taken care of, but they.
Oh, is that the thing like in the movies they have like it looks like a big plastic smushy thing and they're like smushing it?
Yeah, the blue bag valve. Yeah.
Yeah. Gotcha.
I'm trying to make it. I'm trying to explain it without sounding like.
No, you're doing great.
I'm a nurse and I know everything.
No, you're doing great.
Yeah. So, it's just like you just every time you go in, you don't know what to expect. But we've been doing pretty good with PPE so far. We still have, knock on wood, good PPE. But a lot of the times, like they were telling us, they're afraid that the city was going to take our vents, our extra vents, and take our PPE and try to limit us because we weren't a high priority. But thankfully, my hospital was, they had to be smart about it. They're still providing us with the gear we need.
Good. All right, and then the other part of that, did you get coworkers that were getting sick?
Yeah, we got a pregnant coworker that got it.
Oh, no.
Yeah,
is she okay?
She's doing okay. She's a tech. She's great. That's why I feel so bad. She's 6 months pregnant, and I think about that, and she tested positive, so she had to be out of work, obviously. So 3 weeks later, she gets another test, and it's still positive, but she's not symptomatic. So the thing with all the testing is just so strange. We've had patients, we do different types of testing. There's rapids, which you get the results back in 15 minutes, I believe. Mm-hmm. Then we have to send a test to the Department of Health, and that can come back negative. But I've seen patients with a negative rapid, a positive rapid, and then a negative. And I can't say, are they going deep enough? But it's happening so much. I just feel like this is just a different kind of virus.
Yeah, my mom was saying that they've been getting, all right, so for people who don't know, my mom also works with COVID patients, but she's doing it she's not in the hospital. She's working with patients at it's like a primary care group. Actually, I think they have all sorts of care, but she works with the primary care group, part of the group. And so they're monitoring their patients who are not hospitalized, and then once they get to the point where they have to be hospitalized, she sends them to our guest Peggy.
Yeah. Your mom usually works in the hospital. She's volunteering to do this position, so kudos to her.
But she was also saying that with her patients that recovered out of the hospital, so they never ended up getting so bad they needed to be hospitalized, one of the things she does with them is the follow-up tests too, and she was saying that they are getting positive results from patients who have recovered and are asymptomatic, which is like the same thing you're saying.
Yeah, but what's scary is that they're saying, this is just preliminary stuff, so take it with a grain of salt, people, but I've been seeing instances where people are positive, then they retest after 2 or 3 weeks, they're negative, and then all of a sudden they become symptomatic again. So it's kind of like it's coming back. It's a virus, so obviously it can come back, but that's what's scary about it. That's why I think it's like a cancer cell and attaches to your cells. This is all my opinion. Okay. All opinion. Don't think this is all true, but if that's true, like it would make sense that it's mutating cells. And that's strictly opinion, but I just think that's really strange.
Well, that kind of goes to one of the questions that, Marquita and my cousin Mark actually asked about this, about the toxic shock syndrome to child patients. And the way that I heard about this, obviously I'm interested to hear your take on it, because I wasn't even quite sure I knew what they were talking about, but it was, a lot of these kids are not having, they're not having as severe or even affected by the virus as much as adults are. That's what everyone's been saying. But then now, later on, there's these symptoms that are showing up in them. Am I getting that right?
Yes, there's people that are showing, I don't work with children. I'm an adult cardiac nurse, but
Okay.
we actually are sending any child that comes in the ER that is what we call a PUI, patient under investigation, because you have to wait testing and things like that. They'll send them, I believe, don't quote me on this, Westchester. We're sending them out because which I think is smart. We don't want to expose any children to this. So any children that come to the ER, we're sending them out so that they can be protected and not be exposed. Even the patients that aren't under investigation for COVID, we are trying hard to limit this. Yeah. So a lot of the times with the kids is like, I did a little research on it because I was curious because obviously I have a little tyke, and I saw similar symptoms with the adults too. There's this rash that occurs, which is associated, I believe, with called Kawasaki's. It's which is associated with the toxic shock syndrome, because toxic shock it causes vasculitis, which is just inflammation of the veins, the vessels.
Okay.
And when you have an inflammatory response, your body clots. And that's
is
what
that why so many
COVID.
People are getting clots? Because I've definitely heard that people are like people who never had a clot before are getting clots.
Yep, we had a 29-year-old who had a stroke come in.
Wow.
29. So I hate when I see these commercials. Even if you're young, you can spread it to our most vulnerable population. No, I've had 22-year-olds on ventilators that I've taken care of. It's not what they're saying, which is really bothering me a lot. So that's why I'm glad we're doing this, because it's not just the older population that's dying from this. And the younger ones, we had a 28-year-old die from it. He had a lot of medical issues, which I won't get into, but even the ones that are young, they're getting off the vents, but they've been on a vent for a week and a half, and your muscles atrophy, meaning they get weak and they lose their musculature. So it's harder for them to walk at the rate they were before they were on the vent.
Because they can't move at all, right? Like they're just lying there.
Oh yeah, because there's some patients that are on vents that are awake. They're trying to take them off, but they're on medication to help a little bit to sedate them. If you're trying to wean them off the vent, take them off. But most of the time, they're knocked out. And the biggest thing with this, the lungs and the kidneys, and that's related to the clots. Okay. Patients are, so on chest x-rays, if you see what's called opacities, meaning patchy, clouded looking white prints on a chest x-ray on the lungs, that could indicate COVID. So my ICU usually deals with patients with such a decompensated respiratory system, barely to the point where they have to put them on their bellies, called prone. That helps. A lot of COPD patients do it, the smoker patients, where it helps the airways so you can breathe better. They usually deal with keeping patients prone while they're on vents once a year. Every COVID patient, I'd say 85% have been required to be prone to help their oxygenation.
That's so crazy.
Even after they're off the vents, we had a patient in the step-down unit who we try to get into a chair because we're trying to, if you're sitting upright, that helps your respiratory system, helps expand your lungs better. As soon as we got him up, he desatted, his oxygen level dropped from 97%. It's like a test, you want to be...
Which is still low. 97 isn't great.
No, 97 is good. You want to keep them above 92. If you're above 92, you're cool. But once we sat him up, he dropped to 76. So as soon as he lied on his belly, flat, prone, his O2 sat went right up. So it's not even just the vented patients that are doing it. It's ones that are off the vents that need to still do it. So even after, and it could be related to the vents too, but I think it's mostly COVID, it really destroys your respiratory system. Your lungs, it scars them, I think.
Wow. And see, that's the other thing that annoys me is when people are just talking about the death rate as though that's the only bad thing that could happen. Like, I don't want to be on a trach and prone for 2 weeks and then be sedated and then have to come up and try to get my leg muscles to work again and my lungs will never be the same. That sounds terrible. So I didn't die, but like, I still don't want that. Like, that's not nothing, you know?
Yeah, it's been quality of life, and for healthcare workers, our goal is to save patients and give them the best quality. So it's been really disheartening for a lot of healthcare workers because we're trying hard, but COVID at times has kicked our ass, and sometimes, excuse my language, but sometimes we've had patients that come out pretty okay, and it's a victory, but they're small victories. Oh, sorry, but with the so the lungs get greatly affected. And that's related to the clots. And these patients go into what's called DKA. Basically, your body starts breaking down muscle because it's related to diabetes. I don't want to go too crazy on it because it's a lot. But so these patients are going into renal failure and they need something called CRRT, which is chronic renal replacement therapy. And it's basically continuous hemodialysis, 24 hours. And these patients are clotting those machines because they're clotting. And that's why majority of patients are what are called heparin drips, which are it's an anticoagulant, a blood thinner. So it separates the blood to help it flow better. And, you know, it's never been like this before. It's pretty intense.
How, of all the patients that end up in the hospital, because obviously there's the ones who don't even make it to the hospital because they either recover or die at home, one of the two, honestly. But like, then there's the ones that end up in the hospital with you. Like, I mean, I know you can't give me like a exact number, but like, survival to not survival, like, how is it looking from your position? Percentage-wise, rough estimate.
They're surviving, but the percentage of patients having a quality of life is higher than what we would like. I would say, because what was really cool, I saw a patient that I was working with that was intubated, 44 years old.
Wow,
needed to be so prone young. On his belly to help. Yeah, dude, that's what I'm saying. Like, there's 55-year-olds. They're not all 80. It's nuts. And he, needed to be prone because he wasn't breathing well, even with the vent. And with the vents, they deliver oxygen, but you're not trying to have the patient rely on the vent because you want them off the vent.
Right.
So you don't want max settings on those things because it's going to hurt them in the long run. So they're always trying to get them as low as they can. But this guy was not looking good. And I was just felt so bad. I was looking at him like, dude, you're 44 years old. What the heck, man? And he was on the chronic renal replacement therapy. And I floated to the COVID step-down unit again. I only did it twice because I've mostly been in the ICU. And he was there. He was my patient.
Oh, wow.
And, and it was good because he was up, he was awake, and, I got his family on the phone with them because obviously we had no visitors, and they were just so happy. And I've seen victories, but I know there's been casualties, but the quality of life of these patients is going to be affected, and that's going to affect healthcare in the long term because, so basically, if you're on a vent for 2 weeks, you got to get a trach because it's going to destroy your lungs to be on a vent for that amount of time. So
oh my God.
They'll put, at those settings, so that's what they do. After 2 weeks, a patient gets trached, which can be reversed. But obviously we'll see how that works down the road with these COVID patients if they can get their trachs removed. But, it's just new territory.
Yeah.
So long term, we're going to have a lot of these patients coming in the unit, and if this virus can come back, like Lyme disease, Epstein-Barr, and all those, and it's just unknown how this is going to really affect healthcare long term.
Man, that just gave me chills.
Yeah, it's scary. It's scary.
Oh, so about the Kawasaki disease and the kids. So you guys mostly send them to Westchester, so you don't have a lot of first-hand experience with that.
Yeah, but what's really funny is, like, Kawasaki's, these adult patients are getting these weird rashes, and, and the thing with Takasaki syndrome that I know of, I'm not an expert, but I just know it causes septicemia, which is a blood infection. So, basically, pneumonia. You get an infection in your lungs. if you don't get over that pneumonia, especially pneumonia, especially the older population, because they have a weaker immune system than our younger guys and gals, it can travel to your whole body. It can travel to your blood, and then it can shut your organs down. So COVID's causing I believe some kind of inflammatory response, because there's lab levels called like a sedimentation rate, which shows if you're having an inflammatory response, which can be caused by infection, and that causes your body to clot. So it just seems there's a connection with this rash that's indicating some kind of inflammatory process that's causing your body to clot, and then shutting down kidneys and causing people to have strokes and PE, which is pulmonary embolism. A clot travels through your lungs.
Is it weird, like, because I know it's not like you guys haven't been getting exposed to things that are, I don't know, really communicable or that are really dangerous before. You guys have been doing that this whole time. It's just that people weren't paying attention as much. Like, you guys have always been doing that. But the difference, though, is that, like, all the other things, like MRSA, and, I mean, not MRSA, what am I thinking of? What's the other thing? MRSA. It is MRSA? Okay.
MRSA.
And other things, whatever, you're exposed to in hospitals, is that you guys, there's lots of research out there about those things. There's treatment plans for those things. Some of them work better than others, whatever. Is it weird dealing with, I'm asking, is it weird? It must be fucking weird dealing with something that is just so new, and there is no, like, all the research and data is being collected now, like, in real time, as opposed to stuff that people can look back on and try to come up with, like, things based on this study or that study. Now it's just like, oh, we're still making up the studies right now.
Yeah, I mean, but to be honest, yeah, it's weird, but like you said, I'm used to going into a shift and saying, all right, well, you got a patient who's on C. diff precautions, which is Clostridium difficile. It's a infection.
That's the one I was trying to think of. I wasn't trying to think of MRSA. It was that one.
But MRSA, but yes, you're right. MRSA, if there's a staph infection, there's different precautions. So with MRSA or VRE, which is usually in the urine, which can be contagious, I wear a gown, gloves, and if you choose, a mask, which I always do because C. diff smells so bad. Sorry if you're eating a sandwich.
Oh, yeah.
Put a disclaimer. Don't listen unless you're not eating food. So, so we always, we deal with this stuff all the time. Flu, pneumonia, the staph infections, VRE, C. diff. We're used to this. So for me, maybe it's just my denial of it, but I go in thinking, like, this is my job, and I hate when nurses say, this is not what I signed up for. Yeah, if you're not getting the proper PPE, I get it. I would be upset about that, and I don't argue with that comment for those people. But if I'm going with PPE and I can protect myself and my family and my community, I'm cool with it. Remember when AIDS came about? Yeah. No one knew about it. People didn't even know if they could touch these patients, and the only people that were in there, nurses. And Ebola. Right. I mean, it literally took nurses. We watched a video during the ICU class about, like, every 2 years some crazy pandemic happens. Well, right. Not pandemic. I mean, it's never been this bad. I mean, it has been, but not in a long time, shall I say. But you have to expect. I expect this. It's healthcare. Right. The world's changing. Yeah. The environment's changing. I mean, soon we're going to have mosquitoes and malaria to deal with. And right. Who knows? Maybe next year. Mm-hmm. I mean, you have to expect that the healthcare system is going to change and different diseases are going to come up, because that's how it's always been, but not at this level. So I hope in the future we can put in emergency plans for this kind of thing. Just, always have a secure stockpile, have an emergency plan out which units you're going to close down first and what protocols you're going to follow, because we weren't ready for this, and we did adapt quick at my hospital. It took time, but I mean, considering, I think they did a decent job adapting to what was occurring, and so that's it about that, I guess. That's awesome. I don't know if I answered the question.
No, yeah, for sure. And also, you brought up the next question I wanted to ask, where you were talking about...
Oh, I'm doing good at this. I did that every time. Oh, now I jinxed myself. 3 for 3. I think that's it.
Well, the
Darn.
next question I wanted to ask about was because you were talking about how you've been dealing with communicable diseases for a long time, so that part is something you guys understand and all that. Well, this is a question from Alex. I'm not, sorry, Alex, I cannot pronounce that last name. I'm
First initial, keep it HIPAA.
It begins with an M. And
Okay, Alex M.
Do they think, or can they make any more in the trenches observations regarding the opinions of the lockdown, of that the lockdown, social distancing measures, personal protection guidelines, and even delayed reopenings are unnecessary, oppressive demands to make of the public facing this pandemic?
Oh, I'm ready for this one.
Yeah. So, all right, for the people out there who are saying that they're being discriminated against, they're being persecuted, their rights are being removed by these oppressive distancing measures. What is your opinion as somebody who who understands communicable disease and is having very close contact with this specific pandemic right now?
The thing is, I wish I could get a TV crew to blur out all these patients' faces and reveal their ages and to show what we're seeing. I get it. If you're not in it, you don't know. I would feel the same way, honestly. If I didn't see what was actually happening in the hospitals, I'd be like, this is fake governmental conspiracy. They're out to get me. It's not. It is not. And I've had my dad. He's a baby boomer. He's been saying that, we have to reopen the economy is ridiculous. This is all bull. And I told him what I'm living, and people are stubborn. And what really bothers me is that, yes, the government stepped in and said, you guys have to do this, social distancing, close these places down, because the public can't be trusted to do it on their own. And that's sad, because when this all started, I knew what was going on. I work in a hospital with COVID patients. I went in grocery shopping, I think it was like March 3rd, wearing my N95 mask. No one's in gear. I have little kids saying, okay, I got COVID, coughing, like trying to be funny. And I responded,
because they saw you wearing a mask in public before everyone else was doing it.
Exactly. And now I go to the grocery store, there's a sign saying it's required to wear a mask. It's social responsibility. Mm-hmm. There are very intelligent people out there that would follow the protocols that the government has instituted. But once that's lifted, I don't see the major population doing that. And that's the issue. If we could maintain ourselves and police ourselves and say, hey, I can go to these public places, but I will wear protective gear and I will stay 6 feet away from people. Yep. And maybe, during this time, not blaming businesses, but set up a plan for when opening starts and slowly transition to here's a ticket system or reservations online and or a phone call, and we can only fit this amount of people at this time. We have to keep everybody separated. I know that hurts business, but include takeout with that, and that's been a huge thing. I waited 2 hours to get food because the delivery's banging right now, and I'm happy for that. So we need to adapt ourselves without governmental influence.
This is why it's so disheartening, though, because, what you said makes perfect sense. Yeah, that would be the best way to go about doing it. But you've seen all these videos going around of people losing their shit at Olive Garden and, starting fights in the parking lot because they weren't allowed in because they didn't make the reservation ahead of time. You saw that, right? Or did you not?
Yeah.
It's just people
I've seen all those. Well, that's the problem is that, we got people protesting nurses. Thank God the South isn't being affected that badly. Sorry if you live in the South. I'm not saying everybody, but the majority of people, and what I've seen is that, we're gunslinging Americans. We have the right, but you have to protect yourself. We are living in this is a different world now. And if you can't adapt, you're going to overwhelm the hospitals. So if you don't want to protect yourself, just sign a DNR, do not resuscitate, so I won't do compressions on you, and a do not intubate, DNI. Because if you want to do what you want to do, then don't burden the healthcare system for people who actually are trying to do what they need to do to protect themselves and then catching something from you because you're not doing your part.
This is why I'm keeping you anonymous, Peggy, because while I absolutely 100% agree with that, and I feel like if you are willing to ignore every fucking health recommendation and put everyone around you at risk, and then you get sick, I don't think you should get fucking healthcare. Honestly, I'm just saying that right now. You fucked it up for everyone else around you. We're so stubborn and said this was all fucking scam. So if it's a scam, you don't need to be at the hospital if it's a scam, right? Whatever.
Well, if you, no. What?
I'm sure some HR asshole at your hospital will be like, you can't say that.
Well, actually, I'm not gonna lie. HR's been good to me. They've been pushing to help the nurses. So, but what I mean is, I don't mean like don't go to the hospital. Like, we can make you comfortable, but if you don't want to do that, don't make us intubate you, and then you get mad for your quality of life afterwards because you got COVID. Just, sign the DNR/DNI, so when you come in, we don't do compressions on you, we don't stick a tube down your throat, and we can help you be comfortable. And honestly, let you pass, because if you're not intubated and you're not getting chest compressions, your body's not going to save you.
You're nicer than me. I'm like, no, fuck off. You should go have to sign a piece of paper that says, all right, I don't want to wear a mask in grocery stores, and I want to reopen my business. And so in order to be able to legally do that, I have to sign a piece of paper that says if I get COVID, I got to go fuck off. That's what I personally think. I know your whole life mission is to help people and save people, so you're a lot nicer about it than I am, but I think that should be a rule. If you don't want to wear a mask at the grocery store, then you have to sign a piece of paper that says, I'm not going to burden the health system with my bullshit when this blows up in my face.
Yeah. Well, I mean, it got to the point where we were told one day in a meeting, because we do, when it's change of shift, night shift and day shift nurses, we do sometimes a group huddle. Well, a lot of time a group huddle, which takes up a lot of time, but I get why they do it. But the ICU nurse manager came down when this was all really starting, and they were starting the ICU classes for the med-surg nurses, and she read this this letter from a doctor, and basically, I just remember really one part. It said, there's no emergency in a pandemic, because we were wondering about code blues. When a patient loses a pulse and is unresponsive, you call code blue, which means you get them on a defibrillator, you get respiratory there, you get nurses there. I'm part of the code blue team, so we really need to know. People were telling us, we don't do compressions and get in there on the COVID patients. Oh, well, we do, and no one knew because this was just also new. Right. So they said, because it was the beginning where, thank goodness, we didn't have any code blues at that time, but the ICU nurse is there's no emergency in a pandemic. If you guys aren't safe, you get sick, you could die, which a nurse did die. She jumped in and did compressions on a patient and caught COVID, and she died. She didn't put on her gear because
at your hospital?
Not our hospital, no.
Oh, okay.
Sorry, I should have clarified that, but I just feel like all nurses are nurses. So for me, if I get it, if there's an 80-year-old cachectic, meaning really skinny and fragile patient, I'm not going to be inclined to jump in there and pound on their chest. But if there's a 44-year-old person in there who needs to be resuscitated, it's going to be hard for me not to. I signed up to save lives, not to let them die unless that's their wishes. And if that patient's a full code, just because they have COVID, I can't not do that. So after that conversation, we didn't cry, but we were all tearing and really, bothered by it. But we now, shortly after that, our hospital put in, on the code cards, which is what we use. It's got atropine, a medication that increases your heart rate, epinephrine, amiodarone, which is what you do to get that, if they're in a bad heart rhythm, get them back into a normal one. So they would have N95 masks on the cart, gown. So even if the patient wasn't COVID positive or had no risk of being COVID positive, every time you go in for a code blue, you fully gown up in PPE and go in there. So, it's been a back and forth. So for me to say if you want to be a dumbass, excuse my language, and go expose everybody. I don't like that. But when you're in the hospital, I mean, don't waste time and resources. I mean, if you're signing your death sentence, and sign that paperwork, and you need to come to the hospital, we'll take care of you. We'll keep you comfortable, but don't waste our vents when there's someone else that actually, accidentally caught it, or just they were a healthcare worker, or they were working, at a group home. I mean, we had patients I had a 23-year-old on that step-down COVID unit, 23 with MR, which I hate that. Yeah, and they had I'll tell you the story. There was 2 workers in the room, and they're in full PPE, and they're asking me questions. They're like, well, I have my family. I have a 5-year-old. Like, what do I do? I feel like I've been exposed. And this is like literally like 2 weeks into this COVID situation, and I'm just telling them everything that I know, because no one knew anything. Yeah. Said, maintain 6 feet, wear a mask. If you don't feel right, you stay in a room and monitor your symptoms and your temperature, but you need to self-quarantine. You got to stay away from your family, and that's hard, but it's better than feeling responsible for any complications they would suffer.
Right, especially if this turns out to be a chronic thing, like what the people are scared of right now.
Yeah.
Yeah. All right, so hold on. You were talking about, I was saying a real mean thing about letting people die, and you were saying, like, no, you should just let yourself die, and we'll make you comfortable.
Yeah, well, it's something like yourself die. It's just, if you don't want to, as soon as a patient comes into the hospital, we do an admission assessment. So we ask them, do you want blood transfusions, or do we mark you as no? Or, have you had your flu and pneumonia vaccine, so we can offer it to you? Mm-hmm. So one of those questions, which is the most important, is, do you want to be a DNR, which means we don't do chest compressions on you. We'll still give you medications to try to keep you alive, but we're not going to pump on your chest. And, are you okay with us intubating you, putting a tube down your throat and putting on a vent? Not saying you'll stay on it forever. We'll try to get you off. So it's just saying, give me and you can even specify, like, I don't want medication. I just want antibiotics. I want to come to the hospital.
If you don't feel comfortable answering this, you don't have to, but I was always had the idea from, I guess, just medical people I grew up around, that a lot of them aren't really, a lot of them do DNRs and DNIs a lot earlier and younger and more healthy than general population does, because they know firsthand how rough it is to try to recover from certain procedures.
Oh no, if you're young, I mean, if you don't have a crazy medical history, I mean, you should be a full code, because, I mean, I've seen people without COVID, be on ventilators and then come out and they're okay. And sometimes it's just because they have a massive heart attack and you just need to get them through the time. And, they afterwards they come back and they're cool. But the COVID patients are on vents a lot longer. We can't get them off as easily. Mm. That's the problem. And people are saying that it's the ventilators that are killing these patients. I'm like, all right, well then don't put them on a vent if you feel that way, and then they'll die. I mean, it's just, nothing's perfect, but if, you don't want to baby the lungs too long. But
so what you're saying is I shouldn't sign a DNR yet?
No. Are you out of your mind? Don't you dare.
Why not? I don't know. Whenever I tell people that I want a DNR, they're always like, don't do it. And I was like, I kind of want to do it though. Why not?
It's your choice.
I don't want to leave a hospital at my age with brain damage, not being able to function the same way in the world. I have too many years left that would be affected.
Yeah. It's risk benefit. Honestly, we go through our numbers on, the results of code blues, and when we do chest compressions and how all the patients come out. Our hospital's actually got a good percentage of patients coming out with no complications from it. But as in anything, like if you go for an easy surgical procedure, we could perforate, meaning puncture your artery, or you could be fine. It's just,
right.
It's either take the risk or don't, but it's a tough decision. But that's why now, we call them MOLST forms up here in New York. I think New York's the only place that has them. Obviously.
They don't have MOLST forms in the States?
I worked in Connecticut. They didn't have a MOLST. It's a certain form, but it's not called that. And this form is, it asks, do you want antibiotics? Do you want to be a DNR, but you want to be intubated, which makes no sense. Like, if you're going to do one, usually you should just do the other. But, it's very detailed, so you can say exactly what you want. Like, I don't want a feeding tube. I want a feeding tube, which it's complicated. You just don't know. It's a roll of the dice.
Especially if you don't know what those actually mean in terms of outcomes for you. You know what I mean? Like, a feeding tube sounds great if you don't know all the details of how a feeding tube works. And then if you do, then you actually have to think about it a little harder.
Yeah. Well, some of them can be placed. They just give you extra nutrition. A lot of cancer patients get them. And they can be removed. It could be a short-term thing, and sometimes they're long-term things. It is not cut and dry. So if you don't want to be resuscitated, that is your right, and you should always do what you feel comfortable with, but always do what you do, all the research, and make sure. But I'm going full code, and if anything's going wrong, April, just insert like 100 units of insulin or potassium, and bye-bye. Because I don't want to be a vegetable, but if there's a chance of me coming out, I'll come out.
Yeah. All right. Well, I guess I won't sign the DNR quite yet because my nurse friend told me not to.
No, don't say that. I'm not trying. No, I did not. General public that's watching this, I did not say that. April has the right to choose. But I'm just saying, you're so young. It's just, if you're young, your body's still able to fight better than an elderly person. So if you're 80 years old, I mean, some people are like, we get 98-year-olds that are full codes, and I'm like, oh, I really hope I don't got a pump on your chest, buddy. I'll crack it. I mean, it's just your bones get more fragile when you're older. You can't fight infection as well.
Yeah.
I mean, you could get pneumonia and survive, but a 90-year-old is much less likely to survive that.
You know what I think it is mostly is that I think I fear living the rest of my life with any kind of permanent brain damage, which you would get if you were, your oxygen was too low for too long. So that's why I always was like, maybe I should just get a DNR. It's like, I don't know. Like, that's, like, if my body being fucked up, I think I could deal with that. There's things you can do nowadays, and there's a lot more options and a lot more therapies, but I don't know if I can handle my brain being fucked up.
Oh, no, of course. And that's a complication. If your heart stops, you're not perfusing, meaning you're not pumping enough blood to your entire body to provide oxygen to all your organs, which most importantly is your brain. But your body is amazing. So if you're ever in that state, your body knows to pump blood to the essential organs. The body is amazing because it goes to your brain and your heart. That's where it perfuses to first, because it knows those are the core organs. And I mean, the heart that's why I love cardiac. That's why I always just had a thing for it. It's your engine, like your car. I mean, it's responsible for pumping your blood to your entire body and giving every organ oxygen. It's amazing.
All right, I'm going to ask you one more question from the people who sent in questions.
Oh, are those all the questions? I was hoping for more.
I skipped a little bit of details of the questions because a lot of these we've gone over already.
Oh, yeah, sorry, guys. I probably
No, it's good. It's better that it comes up naturally than having to, But this one I thought was good. It's part of her bigger question, but some of the emotions that you've had to go through, whether you felt it due to needing to isolate from friends and family and dealing with people's YouTube research, that's in quotes obviously, and other quotes experts.
Yeah. Everyone always asks, like, oh, are you okay going through all this? I mean, I've had some moments where I was really just disheartened after work. I mean, you did everything for those patients, but you just leave and they're still on the ventilators and they're 20, 40, 50 years old, 60 years old, and you're watching their families use Zoom to talk to them, and some of them are crying, and some of them are just, having normal conversations, and it's hard because your goal is to save lives and provide best quality of life and to advocate for your patients and give them what they need. But this is a whole different beast. So it's different, but I'm used to going in and dealing with infectious disease, and I do everything I can to protect myself, my family when I come home. I mean, I have a whole routine when I come home. We're not going to go into that, but it's been hard, and there's been a lot of people that have been having a hard time. I mean, there was an ER doctor that committed suicide.
Yep. It's weird. I back when I was doing suicide intervention as part of my job, I used to do trainings for lay people who wanted to intervene with someone who was suicidal. So it was very, not dumbed down, but in a way that is appropriate for somebody who doesn't have the clinical background to be actually providing any kind of therapy, just like a basic intervention sort of stuff. And so one of the things we did is like looking for high-risk groups. And I can't remember if it was all medical professionals, but I know doctors specifically have a suicide rate that is on par with veterans.
Really?
Veterans who have had suicide attempts, and the percentage of doctors and medical students who have had suicide attempts was very close, like within like 10% or something like that.
Yeah. Well, my sister, she's an anesthesiologist, so she never was suicidal, but she had a lot of stress from doing the programs that she went through, and I understand that, but that's just general? That's not related to COVID thing?
No. This was back when I was doing the suicide training, so we were just looking at lists of different high-risk suicide groups, so it's, older white men, veterans, there's a whole bunch of them, and one of them was doctors and medical students.
Yeah, my opinion of that is PTSD, because, nursing school was intense, because they try to make you cry because they want you to be tough, stand up and advocate your patients, don't let doctors tell you something that is wrong, that kind of thing.
Yeah.
But doctors go through, for my sister, she did 10 years, and it's, you have to be responsible for someone's life, and you can get sued over it and lose your license. So you need to know your stuff and be confident. So they it's like the Army. That's why the numbers can match. You are trained.
And maybe that's why, and I'm allowed to say this, my dad's a doctor, maybe that's why doctors are kind of dicks sometimes. Because they're just like, oh, I have to be like the guy in charge all the time. You know what I mean?
Yeah.
Not that that's my dad. My dad is not a dick. He's great. But my personal experience with doctors, sometimes they can be kind of dicks.
It's hard.
You're trying so hard to be politically correct right now. It's so sweet.
I know. Well, no, your dad's awesome. I've seen.
No, my dad is awesome.
Your dad,
I'm not saying
any anger.
I'm just using him as an excuse for why I'm allowed to talk shit. That's all. He's not like that.
Well, you got to deal, because even when it's not COVID, you're caring for these patients, but it's kind of a hospitality service. You have to make sure they're happy, healthy, and enjoying their stay. Hospitals have changed so much. It used to be, we're just here to keep you alive and keep you comfortable and do our best to make sure you got the good food that you wanted. But now it's like, my roast beef is cold. I'm like, well, you're dying right now, so maybe we can wait on the roast beef? Like, why can't I eat anything? Because you're going for a catheterization and you need some stents so you don't have another heart attack and you survive.
Yeah, I just want to put
and you're dealing with family members.
So do not be fucking rude to your nurse. Okay, I know that you're sick, and I know you're not being your best self right now. But I was gonna say just like you don't get to be rude to your server because you're having a bad day, but people are rude to their servers when they're having a bad day. So what am I fucking talking about? But you're not allowed to be rude to your nurse because you're sick. Just because doesn't give you an excuse. I know it's an explanation, like, oh, you're not yourself. You're acting out of character because you're so sick. Nah, those people are in there trying to save your life. Stop being, I was going to say a cunt, and then I tried to stop myself, and now I'm saying it. So don't be a cunt. Yeah. Leave the nurse alone.
Well, that's the thing.
What they've been through.
Well, that's the thing, though, because if you're a jerk when you're healthy, it's amplified when you're sick. But I've had a lot of I worked last night. I used to work night shift. Now I'm day shift. I worked yesterday, and I had a great patient group. I was so lucky, and they're just so thankful. They're like, "Thank you so much. You stay safe. Thank you for everything." And that's when you feel like, okay, awesome. This is why I got into this. And then sometimes I get a patient who's trying to throw a urinal at me and saying they're going to call security if they don't get their pain meds, and I say, well, then when you calm down, I'll come back, okay? See you in a little bit. And then you got to be tough. That's why you have to have a skin. Like I've had patients be like, my TV's not working. This is ridiculous. And I look at them and I'm like, or I had a bad day. You know, this happened during the day. I'm like, well, I'm here now. I'm here to help you. Do you want to have a good night or a bad night? I want to have a good night. Well, then I can't change what happened before. What can I do for you now? I mean, some people, I mean, you can't change people, and I see people at their worst. And sometimes I see, like, just the amazing humanity that's out there that I barely see, and that was me yesterday. I had a wonderful patient who was just a couple that were just so thankful and so sweet. But I mean, and still with this whole COVID thing going on, we're dealing with normal things. I had a patient who needed a pacemaker, and towards the end of the shift, I'm like, oh, this has been a good shift. Then all of a sudden he started going to pauses, meaning his heart wasn't beating. I'm like, oh. So I go in, he's like, oh, I feel so good. I'm like, all right, well, I'm going to stay in here with you. Let's put you on the defibrillator because I might need to pace you out, meaning make your heart beat with the machine. And then he's like, it's coming again. I'm like, oh, God. And then he passed out. I'm like, Code Blue, I need help. Everyone runs in, and we started pacing him. He's in pain because when you're getting shocked and we're making your heart beat, that's going to happen. We got him some IV morphine, and we transferred him to the ICU. I mean, that's why it's important that we keep the hospital levels down, because we have normal patients that are in emergencies. They need defibrillators or pacemakers because they could die, but they don't have COVID. So if we keep getting patients that have toe pain and an abscess that their boyfriend tried to cut open with a dirty knife, and now you got a staph infection. I mean, that's happened. I've had a patient, like 33 years old.
I'm not going to even sit here and act like if somebody that I knew had a cyst that I wouldn't beg them to let me express it. But so I can't even talk shit.
Well, just sterilize it first. That's all I'm asking.
I promise.
But I mean, we can't. That's why I'm worried about reopening, is because once we reopen, everyone's going to go back to saying, hey, we're not being regulated by the government. No masks, no social distancing. I'm going to go to the hospital because I want to miss work the next day. Not saying that always happens, or just, something that can go to urgent care, or telemedicine. I mean, get it checked out. Mm-hmm. And once we reopen, I mean, we're going to be at max capacity, and we were before COVID. Once we started instituting this quarantine, we had less patients coming in, so we were able to manage what we were getting. But before that, we were at max capacity, and we can't divert to other hospitals because they were at max capacity, and we're legally not really allowed to do that. You got to go to the nearest hospital. And I mean, we were having, in my unit, I've got amiodarone drips for arrhythmia, cardizem drips for heart rate control and atrial fibrillation, Lasix strips, and then heparin drips. I mean, you're managing 7 of these kind of patients, and they can go bad. And then, so when COVID kind of happened, I've had less anxiety going to work because the patient load has been less. And it's been a little nice, but I'm worried once we reopen, which we're already doing elective surgeries, I believe. They've been cleaning the units for like 2 weeks now that were COVID units, and they're actually putting them in pediatrics. We're not taking any pediatric patients right now. We're transferring them out. So it's, that's what I'm worried for, is when everything reopens, are we gonna
have another spike?
Yeah, I mean, are we gonna take responsibility and not let the government make us follow proper protocol? I mean, are we gonna do that ourselves? I hope, but I honestly, from what I've seen, I kind of doubt it. That's what worries me. So I'm good right now, but I'm a little worried about what's going to happen, because it's everything's opening up slowly. Parks that were closed for weeks now. I mean, we're doing elective surgery soon. It's a lot.
Yeah, and it's easy for people, I think, to not to downplay in their mind, and I'm not even saying people, honestly, me too. It's easy for us to think that things are done. Not done, but like I definitely, like, my anxiety level, and not that I'm saying it's good to be anxious all the time. It's not, but like, one nice thing about having some kind of anxiety level about things is it makes you be careful. Like, anxiety is not just a bad thing. Sometimes it's useful. If you're anxious about getting sick, then you're going to be careful when you go out. You're going to use proper hand washing. You're going to wear a mask. And then once you're not worried about it anymore, even if you logically, like, I know on an intelligence level that this is not over and that I'm not sitting here pretending or thinking that it is over, but there's definitely an amount of be feeling more relaxed about it and a little bit less having my guard down a little less, that could lead to all of us getting higher risks of getting sick.
Yeah, I mean, that's natural. It's fight or flight. Your sympathetic nervous system is saying, you're in danger, and I'm going to protect you. Anxiety is a normal response. It's when it's impeding your ability to maintain a normal life where it's too much. But that's what this is doing. And I hope people stay a little anxious and keep that fight or flight. But some people are still not having that during it.
Right. Yeah. No, this is useful for me because, like I'm saying, like I'm not walking around like thinking that because some idiot on YouTube said that COVID is fake, that it's fake. I know it's real. I know the dangers. I know I have my parents who are in the medical field. Like, I know the dangers, but even in myself, I can feel like a little bit less, like just focus on being as careful and as good about just like, just general safety in public, and like, oh, maybe I can do this and this soon. No. We need to, even if we're allowed legally to do this and this soon, we still should be treating this like it is a big deal and a personal responsibility to prevent it from getting any worse.
Exactly. Again. Personal responsibility, that's key. But the thing is, I mean, in China, they would wear masks all the time. I mean, this is going to be the new norm here. We've had something like this, and not this, degree, every 2 years. We had Ebola. I mean, we've had H1N1. We've had AIDS. I mean, this is not new, but it's going to get worse because the world is changing. Global warming. We're going to get mosquitoes here more than we would like, and they're going to be vectors for things that we're not ready for. So this is going to be the new norm. So people, unfortunately, need to get used to this kind of thing happening again. This is, in my opinion, straight up opinion, this is not the last one we see. And
this might not even be the last part of this one.
It's like going to last for years.
If what you guys are seeing pans out to be like a trend in everywhere where this is happening, where it's becoming more and more, well, not more and more, but that it continues to have side effects that were not expected and returning for people after they recovered. Dude, that's some fucking crazy shit. Like, that puts a whole nother like wrinkle in the whole thing.
Oh, the healthcare system's gonna change forever from this. We're gonna have even more patients coming in, and this is my 6th hospital because I've been, I started on my oncology hospice unit, which was cardiac. Then I went to cardiothoracic step down, which is open heart, and now I'm on a post-cardiac unit. Well, whatever. Go PCU. And I've worked with such amazing nurses. I mean, I see these ICU nurses and med-surg nurses busting their butts to just take the best care of their patients and dealing with family phone calls, and they're swamped with 1,000 things and advocating for their patients. It's been a hard time, but it's been really cool to see how everybody is just doing their job. And I mean, it's great to see. But yeah, this is going to affect us long term, and it's probably not going to be the last one. And this one's going to affect us for a long time.
Well, that's real fucking depressing.
Sorry.
No, I'm just trying to think of, like, how can we go out on a positive note, because we should wrap it up, but I'm trying to, like, well, now I don't know.
All right. Well, everyone, watch your apocalyptic movies, zombies. Yeah. Who knows? Maybe COVID's going to bring people back to life. Who knows? I can't say, but think of it like a movie. But we are growing up in a weird freaking time. So we just we have to adapt, and especially our generation. I feel like we've been exposed to just the craziest stuff, but we persevere, and so that's all you can do day by day, and just try to enjoy life, because at least we still have it. And if you're healthy and able to enjoy, then do it. And I hope everybody's staying safe out there and their families. But COVID is real. I wish I could bring a news crew and blur out the patients' faces to protect HIPAA, and so they could see. I mean, I've been in PPE for 9 hours straight, and then I took a 20-minute break and went right back in it. Pressure ulcers and blisters on my face. I mean, I know how to. I had a stage 1 on my nose, and I just put like barrier cream on it and let it sit, and it dissipated. I mean, put on a gown, booties, 2 masks, a bonnet, and goggles for 8 hours at a time. Take 20-minute break, and then put it on for another 5. Then tell me how you feel. If you don't think COVID's real, I'm sorry for you, because I'm living it. I get it. If I wasn't in the hospital setting, I wouldn't believe it. If you're not exposed, how can you believe it's real? It's real. People have to be prone on their bellies for 18 hours, and they're 44 years old, and they are at huge risk to develop pressure ulcers on their faces because of the pressure. It's either live, die, and live with a pressure ulcer, or die. And they're not 80 years old. I'm sorry. It's young people that are getting this too, and that's not what we're used to.
Yeah. So
take it seriously, and if you think the government is trying to control you, I don't think they want to send all these checks out right now. Sorry. I think they want to keep the money for themselves and their yachts and their mansions. They don't want to send you money to trick you. This is not a conspiracy. Yeah. If they weren't sending you money, I'd get it. But they are sending you money. They don't want to do that.
That's true. That's a good point.
I just don't get it. Like, the government's out to get me. Oh, I got $2,000. Good. Okay. They don't want to do that. So I'm glad the government's even taking it seriously, minus Trump. I don't agree with everything that they're instituting, but we've never dealt with something like this before, and this is going to be the learning curve. We're going to take this experience to use for future occurrences of this, because this is definitely not the last.
I really hope so. It's not like after the Ebola, there wasn't a big push to change the system to make it better to handle a pandemic, and we didn't do anything. Like, we said we were gonna, but we didn't.
Because it didn't affect us that much. It's exactly. Like when you're like, oh, this street needs a stop sign, because someone's gonna die. They're not gonna put the stop sign in until somebody dies.
Dies. Exactly.
Yeah. So this is because when I came out of I was 2 years out of, maybe a year or two out of nursing school when the Ebola hit. I had a friend who was an Ebola nurse. They're like, it's not so bad. I barely get called. This is much worse. So I hope this was the death from the lack of stop sign that they need.
All right. So just so we can go out without being super depressed, just tell me like one of like a funny or ridiculous or dumb story that's happened at work recently that we can chuckle about, so we don't go out on such a depressing note.
Well, do you want... Oh, okay. I have a lot of stories. Can you... Yeah. You're going to have to even give me a topic on it, because there's just so many
Too
stories.
many?
Yeah, well, there's... I don't know if people want... Because it just... Half of my stories are going to be gross to people.
All right, let's just do it. Everyone who's watching this knows that they're talking to a nurse. If they can't handle it, they can fuck off. Oh, this actually reminds me. We took a little break for a second, and we were talking about how people who work in the medical field have a whole different concept of what is appropriate, like, dinner conversation than people who don't. And fucking just reminded me of this time that it was Thanksgiving dinner. So there was a bunch of family there. It was not just immediate family. Spouses of family members who don't know my parents as well. And my mom decided that during Thanksgiving dinner, it would be a great time to tell everyone about the prolapsed uterus case that she had that day at work. I have never seen so many shocked, sudden suddenly not hungry people before.
Did she describe what it looked like?
Oh yeah, she was telling the whole story. She thought it was the funniest thing ever because I forget what she said. Oh, I guess maybe she was embarrassed about having the prolapsed uterus, so she didn't want to tell the real reason to the secretary or something. But my mom went in there expecting to be examining her for something really benign, like an ingrown hair or something. The woman lifted her gown up and like her uterus was just like sitting on the table. And she's like, so I think we should deal with this before the ingrown hair. Whatever. Anyway, I thought it was hilarious. Everyone at dinner was absolutely mortified. But whatever. My point is that it's all good. If you can't handle stories with blood, stop listening now. Everyone else can enjoy the story.
Okay, so I'm, suctioning one of the patients because there's high pressure on the vent, and then I'm like, oh, you got a lot of secretions. Let's get you. All right, you good. And then I'm walking away. My back is to, so let me set it up. It's just like a big glass wall leading to the outside, but there's all paper on it, so you can't see inside the unit. They got on some tall ladders and like paper the heck out of it so you couldn't see inside. And it was like a horror movie. I was walking away from the patient. My back was to that glass area, and I hear bang, bang, bang. I'm like, what the heck was that? So I turn around, and there's some random dude, and it's really dark because I was working night shift at the time, and he's like waving at me, and I'm like, because he found like a little crevice, and he really couldn't see, but like I could see him, and he's like waving, and I'm like, can I? And I'm like, I can't hear you, but I'm like doing sign language, which I don't know, and I'm like, cannot hear you, waving hands, covering ears, what? And I'm like, look at me, putting my hands from my head to my like legs. I'm like, this, no. And it was, and I waved them off. I'm like, go away. I got more important things to do. Why are you knocking on this door? I'm like, do I call security? So I ended up going out, and there was actually an inmate that was vented, which was one of my patients I was helping. And, there's two guards outside of the unit because legally they have to be there if there's an inmate in the hospital. So I come out, I'm like, hey, I know you don't work here, but there's some random dude knocking on the glass. And then the guy goes, yeah, that was me. I couldn't figure out how to get in here.
Oh my God.
I was like, dude, don't do that. I'm like, do you realize how scary that is? It's 1 a.m. and you're banging on the glass and in the dark, and I can't even see you because I cleaned this face shield and it's from bleach and it makes like a little film, and I can't see anything, but I wasn't afraid because, if you're going to break a thick glass and you're on some PCP or something, I just like, and if you want to expose yourself, so that was probably the funny one.
A CO who was just wanted you to help him get to where he was supposed to be for his job. You'd think that he would know that.
But the hospital has a big sign in front that says the hospital name, and it's obvious that it's the entrance. Like, I don't know where this dude parked, but the only way, he had to park like way far away from the hospital to not realize, hey, this is the entrance, even though there's like 2 little walkways to the front of the hospital. I don't know if he jumped a fence. Maybe he was on PCP. No, I'm kidding. He wasn't on PCP. But I'm just like, why would you knock on that glass? And everyone's like, that would have scared the heck out of me. I'm like, no, I was just mad because your job is to take care of these patients. I'm like, is this guy really trying to distract me from doing my job right now?
Right. Oh
and he's like, I'm sorry, I couldn't get in. I'm like, don't do that. My goal is for these patients to get the best care. And if you're trying to take up my time with something that's not important, I'm going to say something.
Yeah.
It's just like, but it was so funny that I was just like, what is going on, man?
All right. So you know what? Let's leave it at that. Thank you so much for talking with me. This was really fun, and that was really interesting. And everyone, wear your fucking mask. Stay 6 feet away from people. Don't be mean to your nurses. Don't be mean to the kids in the grocery store. Don't be mean if they start reopening businesses and you don't get what you want exactly when you want it. This is a new world. Relax. Be nice. And wear your mask. and don't bang on windows in the hospital in the middle of the night and scare the crap out of Peggy.
Well, no, they didn't scare me. One of the nurses jumped, and I just turned around all mean, like, what are you doing? Everyone's like, oh my gosh.
All right, don't piss off Peggy. She'll come get you.
Yeah, Peggy will come get you. If you mess with my patients, I'm trying to save. I'm going to have a problem with that. But yeah, it's just people be smart. We don't want to end up living in a Mad Max. Going back, throwback to your last. Yeah. We don't want a Mad Max world. It's just, you got to accept things change. And if you can't do that, you're going to have a hard time. So just adapt. We're humans. That's what we're made to do. And do the right thing. Don't let some governmental body tell you how to protect yourselves and others from a situation like this. You should know. We're smarter than that. I have other faith in most people up here, especially the people who are watching this, and just spread the word, because that's all we can do. And if anyone hears of anyone saying COVID isn't real, just, what, people are entitled to what they want to believe. You can't change people's minds, but do what you can. You can't.
Right.
The only control you have is what you do, not what other people do or what this virus does. So just be smart, be safe, and I know this is hard, but we can get through it. We've gotten through worse things.
That's true. That was so good. That was totally uplifting. I don't feel depressed ending it right now.
Good. See?
Thank you so much. You're the best. And I don't know. Maybe we'll have you back sometime.
Thanks for having me on. Yeah, because this is changing. So we could do a follow-up once everything reopens, and I'm curling in the corner saying, I'm dying. Not from COVID, but I'm just dying.
Yes. Then we'll have some shit to talk about.
But just please, people, don't look at it. When you see someone in their scrubs, don't give them stank eye. Like, give them a smile. We need that outside the hospital. I mean, we're going through a lot right now, and it's not easy, but we're doing it because this is what we signed up for. I mean, at least I have a support system at work. I have PPE gear right now, and so in my stance is that just help us to help you. Help me to help you.
All right.
So thanks, man. I appreciate this. This is cool. Thank you, guys. I appreciate the questions. I hope I did them justice, and cool. Thanks, man.
Love you, girl. I'll talk to you
later. Love you too. All right.